We did a single-arm trial in a little over 90 patients, and the patients used a steroid mouthwash 4 times a day for the first 8 weeks. Well, of course, we were going to use our compounded formulation, but to do a trial, you want to have something you can just reach off the shelf and doesn't involve differences in manufacturing. So we used instead an alcohol-free dexamethasone-based mouthwash. It's actually just a way of taking Decadron if you're not swallowing pills, mainly for the pediatric population. There's 0.5 milligrams of dexamethasone in 5 mLs of this solution, and patients actually swished in their mouth and held 10 cc's 4 times a day, and then they spit it out. So they didn't have a systemic exposure to Decadron. Very little absorption is expected through the mucosa of the mouth. And they had a little timer, and then they tracked how they were doing in quality of life, and we tracked their stomatitis. And we actually graded the stomatitis not just by the usual sort of what does your mouth look like, which is very hard, but actually on pain and oral intake, which we added in a previously validated oral ulcer score. And what we saw was that we markedly reduced the incidence of oral stomatitis with this mouthwash, and it's very, very encouraging. So we went down to almost no grade 3 stomatitis. In our primary endpoint, which was 8 weeks, there were no grade 3 stomatitis, whereas there were all the grade 3 stomatitis we saw were in those first 8 weeks in Bolero 2. And then the grade 2 stomatitis, which of course is very bothersome to patients, went way down as well. And we saw some grade 1 stomatitis, but it was a dramatic reduction in the amount of stomatitis, and of course correspondingly a marked increase in the number of patients who had no stomatitis reported.